Hello everyone, welcome to my video channel. Today I am going to talk about growth plate and growth plate injury. In this part 1 video, I will cover regarding the growth plate GP, regarding the zone of growth plate, there is resting zone, proliferative zone, hypertrophic zone, and another regarding primary and secondary spongiosa. And lastly, what is the clinical significance of growth plate itself? So next, what is actually growth plate? GP. Growth plate, or also known as the physis, is a cartilaginous region situated between the epiphysis and metaphysis at the end of immature long bones. It acts as the primary center for longitudinal growth in children of the long bones. Being cartilaginous, the growth plate is the weakest region in the pediatric skeleton and is vulnerable to injuries. Anatomically, the cartilaginous growth plate can be divided into certain zones. From the epiphyseal end to the metaphyseal end, the physis is composed of A. An undifferentiated or resting zone, B. A proliferative zone, and C. A zone of hypertrophy. Then the primary spongiosa and secondary spongiosa itself. The differentiation stages of chondrocytes divide each of the zones. Now, I am going to talk about A, undifferentiated or resting zone. Resting zone act as a reservoir of stem cells or progenitor cells for chondrocytes in the proliferative zone. Each cell can differentiate into chondrocytes and form a cell column parallel to the axis of the long bone. Cells located here also secrete parathyroid hormone-related protein, PTHrP, which modulates the growth plate homeostasis by interacting with a growth factor called the Indian hedgehog, IHH, secreted by the hypertrophic chondrocytes. Parathyroid hormone-related protein mainly preserve the population of resting cells and promotes the chondrocyte proliferation at the upper region of the growth plates. Although these resting cells possess the ability to produce cartilaginous matrix, they tend to remain inactive with lower collagen II and protoglycan production. The main composition of the ECM extracellular matrix in this zone is horizontally aligned collagen II. In summary, resting zone is a storage cells that store the lipids, the glycogen, and proteoglycan aggregates for later growth and matrix production. In this zone, it has low oxygen tension. Diseases that affected in the resting zone include Gaucher's disease, dystrophic dysplasia, pseudoachondroplasia. For B, the proliferative zone. It is located adjacent to the resting zone. The proliferative zone is vital for cellular division and matrix production. It contains vertically arranged chondrocytes. These longitudinal columns of chondrocytes are separated by the cartilage matrix surrounding them. The extracellular matrix, ECM, is mainly produced in this zone and is enriched in vertically aligned collagen type II and aggregan. Diseases associated with proliferative zone are achondroplasia, gigantism. In C, hypertrophic zone. It is regulated by different growth factors, including example, BMP, bone morphogenic protein, FGF, fibroblast growth factor, IGF-1, insulin-like growth factor 1, and TNF, tumor necrosis factor. Chondrocytes in the hypertrophic zone stop proliferating and swell in size. The enlargement of chondrocytes is mostly associated with the longitudinal growth, around 44 to 59% of the longitudinal growth. Hypertrophic zone can be divided into 1. Maturation zone, 2. Degenerative zone, 3. Zone of provisional calcification. In maturation zone, Morkel syndrome and other mucopolysaccharidosis affected this area of face. In zone of provisional calcification, affected diseases are in rickets, and fracture is common through this zone. Hypertrophic zone is mainly associated with matrix mineralization, where the ECM extracellular matrix is mostly composed of collagen 10. Under the influence of low oxygen tension and in the presence of VEGF, vascular endothelial growth factor, the hypertrophic zone allows the blood vessel invasion from the metaphyses. The vessels bring osteoblasts, osteoclasts, and mineralized cartilage resorptive cells to the zone, and thus convert the mineralized matrix into a bone trabecular-like metaphysis. In summary, hypertrophic zone is the zone of chondrocyte maturation, chondrocyte hypertrophy, and chondrocyte calcification. In this zone, SCFE, slip capital femoral epiphysis, goes through this zone. But remember, not slip capital femoral epiphysis, SCFE, that is caused by a renal problem. In metaphyseal region, there is the primary and secondary spongiosa. For primary spongiosa, it is a site for mineralization to form a woven bone. Vascular invasion will occur in this region, and resorption of the transverse septa will occur. Osteoblasts will align on cartilage bars produced by physeal expansion. Primary spongiosa mineralize to form woven bone and then remodels to become secondary spongiosa. Metaphyseal corneal fracture in child abuse and scurvy commonly occur in primary spongiosa region. In secondary spongiosa, internal remodeling will occur with the replacement of woven bone with lamellar bone, and removal of cartilage bars also occurs. There is also an external remodeling with funnelization. Diseases that affect this region are renal SCFE, renal slip capital femoral epiphysis. We are talking blah 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 about growth plate. So, what is the clinical significance of growth plate in the first place? This can be asked in your AC question or your Viva session. Number 1, the clinical significance is the physeal fracture. The common classification that we use are Salter-Harris type classification. Salter-Harris fracture are fracture of the epiphyseal plate. Injury to the epiphyseal plate can result in a decrease in longitudinal growth, angular deformity, and altered joint mechanics. The classification starts with type 1. there is a separation through the physis. In type 2, fracture enters the plane of the physis and exits to the metaphysis. In type 3, fracture enters in the plane of the physis and exits through the epiphysis. In type 4, fracture crosses the physis and extends from the metaphysis to epiphysis. Type 5, there is a crush injury to the physis. I will talk more about physeal injury in my part 2 video. Another clinical significance of growth plate is the forensic significance. Age estimation of the fetus is one of the primary objectives of the fetal autopsy. In forensic fetal osteology, by the embryological method, we are able to determine the gestational age of the fetus. In determining the fetal viability postpartum in forensic practice, the forensic examination of fetal remains by presence or absence of ossification center. The physis becomes clearly defined when the epiphysis has developed a center of ossification, a secondary center of ossification after birth. Okay, that's all for today. I hope you have learned something from this video. See you in the part 2 of this video. Take care and bye.